We are live chat.
Okay, good morning, everybody, and welcome to the Health and Care Scrutiny Committee. We've got 3 items on the agenda today, although I think one of them may be in confidential. So I'll just get to that after the first few items. Have we got any apologies, please, Kath?
Yes, we've received apologies from Councillor Benjamin Breeze and Councillors Chris Walsh.
Okay, thank you. Any declarations of interest on anything on the agenda today from any members? Anyone closely connected with foster carers? No, none of those then, thanks. And then disclosure of party whips? None. And then for the minutes for the meeting that we held on the 8th of March, hopefully you've had a chance to read through these. Has anybody got any additions or amendments that need to be made to those minutes? If not, can I have a proposer and a seconder, please? Gareth proposing, Liz
I'll
seconding.
second.
Oh, any one of those, please, Kath. That's fine.
Yes,
Okay. So moving on to the bulk of today, we're rejigging things around. Do we need to do safer accommodation in private session, Nina?
No, I don't believe so. I've just asked Sharon to confirm, but I believe it's fine for open public session.
Okay, great. So we're going to rejig things around and we're going to go with agenda 6 first before agenda 5. So we are going to be receiving a presentation on the safer accommodation project from the Children's Service. And I'd like to welcome to committee Jo Harris, Sharon Powell and Nina Davis as the director. And I believe you're going to be giving us a presentation. Obviously, we haven't seen this before. So just before we start, are you able to just give us a quick heads up? Is this something for us to note or is this something for us to scrutinise?
This is an item for information, an update on a project. So it is not a piece of scrutiny as such, as for information, Councillor Amanda.
So if we do go into scrutiny type questions such as pace of project, etc., and or if there's anything we want further information on, are you happy to have those today?
Yeah, absolutely. I think that's fine. And we'll do our best to answer all the questions that you may have. And of course, if there's anything we can't, we'll come back to you as soon as possible.
Okay. And does this mean it's coming back to us in the future then to scrutinise, or is it past that stage? Is it shaped rather than being shaped?
This is the updating you on where we are with the project, etc.
Okay.
So,
okay, right. Okay, over to you guys then. I can see your screen. That's hopefully everyone else can. And if we'll have your presentation first, then, and we'll go to questions at the end of the presentation, if that's okay. Hi, Jo.
Hi, Councillor Amanda. Sharon, did you want to introduce, or shall I just crack straight on?
You just to say, and then you can do it. The Safer Accommodation Project's been a project that's been running for a number of years, really, in terms of developing, in terms of what it means, in terms of the collaboration, in terms of Powys Council and Powys Teaching Health Board, in terms of developing a house and a home called Safer Accommodation. So the idea of the Safer Accommodation home is around children with extremely complex needs who might require a delivery of a plan which might fit the criteria for what we call secure accommodation. Secure accommodation is the highest end of the trajectory of any placement that a child can receive. So it's when children are virtually detained in a secure accommodation. They can't leave. It's almost sort of very run in a way that actually feels almost like how the justice system kind of works. So it's only used when it's absolutely necessary. There's a whole process that you have to go through in order to have a child in secure accommodation. So the idea of having safer accommodation is the step down from secure accommodation, whereby you're managing children's needs, which are really, really complex, really sort of high-end kind of need, to try and prevent the need for that secure accommodation. It's a project that's been driven nationally across Wales, with Welsh Government have a really keen interest in local authorities trying to prevent children needing that secure accommodation at the very highest end. So it's a process that we've gone through. It's a journey that we've gone through, in the sense, with Powys Teaching Health Board, into finally having our house and our where we're at to now. So Jo has kind of lived and breathed the project for many years. So she's been involved from the very beginning, right the way through, because it's taken several years to navigate to get us to this point. So it's just a bit of background of what it actually means in terms of principle. But Jo, I'm happy for you to carry on now.
Okay, thanks, Sharon. Yeah, so as Sharon says, then this was a Welsh Government. Can you see my slides? Yeah, okay. So Welsh Government provided both capital and revenue monies to each of the regions across Wales, so that each region can provide and develop safe accommodation for children with very complex needs. So Powys County Council and Powys Teaching Health Board have worked in partnership on the design and the delivery of the provision. And as Sharon says, this is a long-standing project. This has been going on for several years now, throughout COVID and to today. And we're here today really just to provide an update in terms of where we've got to. And as Sharon says, safe accommodation is residential provision intended to address the needs of children displaying behaviours where they are a risk to themselves and others, and they may well have experienced significant trauma. They may have substance misuse, and they're likely to be in crisis. It's targeted at Powys children and young people who are at the highest end of the continuum of need, and may have those acute or complex social, emotional, and mental health or behavioural issues. So the property was purchased with capital funding provided by Welsh Government. And there was, there's been a number of issues across the project. And the initial property that we went to buy, it fell through. And then eventually we found the property that we have now. So we used that capital money to buy the property and make the refurbishments that were needed in order to meet the requirements of CIW for registration. And those requirements are quite significant. So we got our planning permission, and that was back in December 2021. The works are all now completed, and building control have signed those off. And we're delighted to report that we secured CIW registration early 2024. So all of that building work to the property is now complete, which is really good news. Back last summer, we embarked on a recruitment campaign, and we, as a partnership, used value-based recruitment approach. We did a leaflet drop around all of the local postcodes. We did drop-in events both in Newtown and Mehantlas and Llanidloes. We were able to recruit a full staff team, which was great, and we were able to then have them start and embark on that training and induction programme. Although those safeguarding checks and references were put in place. Again, the project has not been easy, and we have lost a couple of those key staff members along the journey, and the challenges around residential care, are well known. It is hard to retain staff, and it is a very competitive market. However, we now do have a full staff team who are in place and providing care at safe accommodation. So what we did with our partners in the health board is that we agreed the model of care, and we agreed those clear pathways. And we have what we call an admissions panel, whereby as partners we come to the table with our registered manager and our responsible individual, and we very carefully match the young people who are placed at the property. So there's the environmental risks of the property, but there's also then the matching of the young people themselves. So the house itself provides 3 placements to Powys children, and it's really important that we get that matching right. The governance of the project, there was a specific project board that was established under the Regional Partnership Exec Board. We report to them regularly in terms of our update, in terms of our progress. So within the project board, it's multi-agency, and Sharon chairs that on behalf of the council. And as I said before, we've got our registered manager who is employed by Powys County Council, and we have our responsible individual, again, also employed by Powys County Council. So although it's a partnership arrangement, Powys County Council are the lead organisation in terms of the employer. So, as I said earlier, we had some challenges with some key staff resignations just prior to our CIW registration, and the registered manager role is a requirement of registration. So that posed a real difficult challenge for us. We were unable to secure that registration without that particular person in post. So we, as a project board, in partnership, agreed to move one of our other registered managers from one of our other homes to safe accommodation to enable us to secure that registration in March 2024. So 2 young people who've been matched to the property moved in just prior to Easter. So we've now got 2 children in placement who are reporting that they're very much enjoying being there. The property that they were at before, the places they had before, were problematic in terms of meeting their needs. Those 2 young people met the criteria, the threshold criteria in terms of their complex needs and the support that they would need at safe accommodation. So the home is open, it's registered, it has a full staff team, and the 2 young people are reporting that they are very happy in their new placements. So in terms of next steps, obviously we'll have a settle-in period now with the 2 young people. We'll consider then future referral requests and matching for a 3rd young person, which, as I said before, we'd have to very, very carefully do to ensure that that's a match for both the property and the young people already in place. We're going to prepare our young people who are in the home currently for transition. They're older young people and they will move on into adulthood over the next sort of 12 to 18 months. So we need to start preparing for that now. We'll continue to recruit as we have staff turnover, and we'll continue to invest in those staff in terms of their training and their development. For young people who are placed at safe accommodation, part of the model of care is around de-escalation. It's around stepping those children back to potentially mainstream residential or even foster placements. So we will look when the 3rd young person is to start thinking about, you know, that step down to alternative provision. We'll review the model of care and the therapeutic intervention support that we provide at the home. So there's a therapist and a psychologist at the home providing that direct support to the young people and the staff team. We'll continue with training and development, and we'll provide, as I say, that therapeutic support for the staff team so that they feel well equipped to be able to meet the needs of those young people. And that's the end of the update.
Great, thank you. Really, yeah, good to hear that it's got to where it's got to. Are you happy? I know it's an update, but are you happy for us to take questions on anything that we just want to know a little bit more about, or you know, just ask about future plans or future needs, etc.? Are you happy with those kind of questions?
Yeah, absolutely, Chair. I think the one thing with this particular home, as is very different with our other residential homes, is this is in collaboration with Powys Teaching Health Board. So the model of care for this particular home is different to our other residential homes, and quite rightly so, because of the complexity and the needs of the individual children that are matched in terms of this home. So there is a specific model of care around that intervention, prevention, but therapeutic lens. So it does have input from a psychologist, as Joe said, but also CAMS are really sort of together with us in terms of the care that we provide for the young people in our care, because it's a collaborative joint partnership arrangement where that CAMS input, the input from the psychologist, the way in which the home operates is very different to our other residential homes. So it's just to add that really in terms of the narrative.
Okay, great. Members, have you got any questions? I know I've got just a few. I'll kick us off then. I'll just run through these quite quickly because you might be able to answer some quickly, or some you might need to go away and get the information for. First of all, I just wondered, is 3 the maximum number of children that can be there? I thought so. Secondly, my question is, what happens with their education and how is that how is that managed from the site? Then the next question is, in terms of the costs of the placement from our end, that we pay into it, how does this compare to what these costs of the placements would have been previously? So is it projected that we're going to be making a savement on placement costs? Do we feel we need more of this provision because it's only a small number of children? And finally, my final question is, in terms of stepping them down, obviously that would be difficult for you to make a judgment based on these individuals' needs, because it's also down to their health needs as well. But how realistic is that compared to how safer accommodation has worked elsewhere? Is it realistic that these children could ever be stepped down and or hopefully go on to be in more of a mainstream family type environmental setting? So those are my questions. Sorry, a few there.
Okay, I'll take them in order. So yeah, it's accommodation for 3 children. That's the maximum we can have in the property, because of the size of the house and the volume of staff that you actually need at any one time to be based there, as well as the therapeutic intervention. But actually, the space is quite amazing in the sense of it's a big property. It's got great outdoor space. It's got great indoor space, so it doesn't feel contained. It's actually the opposite. It's very open and very kind of warm and welcoming, lots of light, etc. So it's a very nice house in terms of what it can actually offer from that perspective. In terms of education, and Charlie's joined us, so she may want to come in and kind of talk a little bit about the individual education plans for these 2 young people that are there currently. But the care plan is a care plan, as you said, Chair, that covers not only the care needs, but it's the health needs, it's the educational needs, it's any other intervention that's needed in terms of that whole package of support for individual children. And those individual needs can be very different. So it doesn't mean to say that a child won't have access to education at all. They absolutely will have access to education. It'll just be tailored to their individual needs and actually where they've come from, what school provision they were having before they came to the property. Can that actually be continued in a different way locally, or actually does it need to be a tailored education provision that's based then in the home? So it all depends on the individual child's needs, but absolutely education is at the forefront of the care plan as well as all the other elements. Charlie, did you want to add anything on education?
No, just that we do try and do the planning well in advance of a child being admitted. So we do have meetings regularly, and with the virtual school, we'll explore all of the options that are available and find the best package really that meets the young person's needs. So it's a very positive sort of collaboration we've got with education at the moment. I think the ones that are currently in placement are looking at college provisions as well, so it broadens it not just from our sort of mainstream school education, but our college education as well. So as Sharon says, it is a very positive working relationship we've got, and hopefully the children then don't have periods out of education.
So that each child is a child looked after, so they are a care experienced child, so they will all have their individual care plans. And as part of that process, they'll have an independent reviewing officer that then reviews their care plans. And that usually is over a 6-month period, but that actually timescale can shorten depending on the needs of individual children if that needs to be shortened. So that independent reviewing officer will absolutely review the child's care plan, their individual needs, their health needs, their therapeutic needs, their educational needs, their contact with their family, and any other information really that's relevant to an individual child's needs. And they are the independent part of it is really important in terms of us as a provision, because they are there to scrutinize that care plan to make sure that the individual child's needs are met and that the delivery of that care plan is undertaken in a timely way. And they will raise things up to myself if they feel that there is any challenge within that care plan, or there's a difference of opinion or a view, or something isn't being met. So it's a real sort of strong process really of how you kind of review that kind of plan and what it means actually for that individual child. In terms of costs for placements, I mean, this is a really good question, Chair, because even though we have got our own children in our own homes, doesn't necessarily mean that the cost is less. So if in terms of a secure accommodation placement, that very high end, which I talked to you about at the beginning, some of the costs for that can be upward of almost £15,000 to £20,000 a week in terms of a placement for a child in that provision. So this is cheaper than that in terms of that cost provision, which is why Welsh Government were really keen that local authorities have different options to be able to care for children through different ways, not only from that cost lens, but actually keeping children more locally and looking at how you can develop different opportunities. So it doesn't necessarily come with a reduced cost, but it does come with a reduced cost in the sense of staff time, staff travelling time. It keeps children much closer to home. It keeps children better connected to their communities, etc. But in order to provide the provision, there are costs, you know, the costs around staffing and all the therapeutic input that needs to happen within that home doesn't necessarily mean it's a lesser cost in comparison to placements. In terms of demand for placements across the UK currently, the costs are going up. So, for example, we've been asked this week to kind of source a placement that doesn't actually meet safer accommodation requirements, but upwards of £12,000 to £15,000 a week. So we're already seeing that costs are actually increasing because demand is increasing. So it doesn't necessarily mean that having our own property is necessarily cheaper, but actually there are different costs lens that you can consider, such as travel time, staff time, etc. As I've said, really, that kind of have a bigger impact in terms of time, etc., in a different way. In terms of whether we're going to develop any more, the plan isn't to right now. It's been quite a lengthy journey for us to get to this point in terms of this current home. So we will go through a process evaluation to work out how effective this home has been. Is it meeting the needs and the expectations of what it was set up for? So we're constantly reviewing that based on needs, demand, and we need to test it out now in terms of practice. Does it actually work in practice? Does the home work? Does the therapeutic element work? Does it actually work for the children and young people that are placed there, etc. really? So that the board now, which I chair, will actually undertake a kind of review of it all over the next 6 months just to see how it all works. Are there any gaps? Are there any things we need to think about differently? It's unlikely that we'd go down the route of having another property such as this, but you can never say never. Maybe we actually think actually it is a good idea. It is a good model. It does work. It is more effective. So there's lots of things we need to consider really over the following 6 months. In terms of stepping down, we are realistic and optimistic that we can step children down from this situation. So in the same way, where if a child was placed in a secure accommodation, the very high end, you wouldn't keep a child in that arrangement for any longer than is absolutely necessary. So plans when a child is there are usually 3 to 6 months, not usually that longer, because you're always looking for a step down approach to something beneath that. And in the same way, the principles will work for this. So this is our high end home with our complex children. So we'll be constantly reviewing the care plans and then looking at stepping those children down into different provision. With the current children that we've got there, as Charlie's indicated, that we are looking at transitional plans out of the home, and those will occur over the next 12 months. And that's the design of it really is about that. It's about a holding position. It's about intervention when those children and young people's complicating factors are at the acutest stage. It's about stability. It's about stabilizing those children's needs at that time. And then it's looking at what are the next steps, where can they move on to? So the model actually is based on that sort of fluid process of coming in when you're at a crisis or a really difficult time, stabilizing, getting the right care plan around that child, and then looking at how you can kind of move a child forwards. Okay, it's work in progress because we need to test the model out to see if that works in terms of its entirety, but the principles of it are very fluid about moving children out into different arrangements and different settings. So I hope
Great.
I've covered all your questions.
Yeah, no,
there.
you have. Thank you. Councillor Gareth, did you want to ask a question?
Yeah, I just wanted a little bit more information around the process that we followed to actually match the children to go into the home, into the house, sorry. And then the second question is, Joe mentioned that it's jointly funded between health and us through grant. That was a long-term revenue funding. Is there an agreement between the two bodies?
Sharon, Joe?
You're on mute.
Sorry, I put myself on mute, and I'll take the matching question, and I'm sure Joe will come in on the funding question. So with the matching process, it's quite a stringent process of a panel, and that panel approves whether those children can be matched or agreed to be matched within the property. That panel comprises of a number of different people, including CAMS workers, social workers, the registered individual, the manager of the home. So there's quite a lot of people that are involved in discussing, debating whether it's an appropriate referral, whether it's an appropriate match. There are set criteria for this particular house because of the CAMS element and the mental health element. So there are some criteria in terms of children need to meet that criteria in order to be considered for the home. Once that decision is made at the panel, the requirement then is for that information to come to the board meeting, and then myself will sign that off at board level in terms of that agreement from that matching process. So it's quite stringent really in terms of how that kind of works. Joe, do you want to come in on the funding?
Yeah, sorry, can I just follow up on that, Sharon?
Yeah, sure.
What about the child's voice in that process?
Yeah, the child obviously have a voice in that
Okay.
completely. They need to kind of need to be part of that process and need to want to come to the home as well as in terms of that. So absolutely, the social worker is there to provide the child's voice within
Okay.
that discussion in terms of that meeting. Yeah. Very, very good point. Thank you.
Yeah, we prepared a video of the home so that young people who may well be matched are able to see the home and online in a video, and with the examples of the two young people who were matched this time, they came and viewed the house, and they were able to see, you know, which bedroom that they might want to select. So they had a lot of input into that decision. And then in terms of the funding, yeah, so as I say, it's a long-standing project. Welsh Government gave the seed money to be able to set up the project. So that the grants that we had was the capital money and the revenue money, and that was seed grant money that we claimed last financial year in terms of the revenue, when there is revenue monies moving into this financial year while we place that third young person. Then the ongoing, the cost will be met by the local authority and the health board. So the health board fund the health element in terms of the therapist and the psychologist, and that comes from health, and the local authority fund the care needs of the young people. So as Sharon said, they're children who are in care, their powers looked after children, and we move their costs from whatever placement they were in previously, and that then makes the budget of the safe accommodation moving forward. So yes, the money was seed money, the capital money to purchase the property was grant money, but ongoing it will be children's services funded in terms of the looked after children budget. It's their placement budget.
So no contribution from health towards the residential elements of the provision? Not
towards the residential care element, but they do fund it in totality, the therapist and the psychologist.
Okay, thank you.
Thank you. I've just seen, Sian, you've got your hand up. Did you want to add something to what Gareth's asked?
No, it was up before, but I think I was after Liz.
Oh, okay. Liz.
Oh, thank you. Thanks, Joe, for the presentation. I found it really easy to follow, you know, in terms of where you've started and where you've ended. My question's about the registered manager. You were saying, you know, that you had some, I suppose, obstacles in terms of staffing, and that did hold up the start of the project. Obviously, that registered manager is a critical role. What will be the position if you were to lose that person? Is there a contingency? And, you know, linking to the recruitment paper that we're going to, you know, hear about later, I just wondered whether, you know, there are plans to make sure that we are in a position to fill posts like that, train people with relevant leadership and management qualifications that they might need?
Really good question, Councillor Liz, in terms of that. And the obstacle that you mentioned really did become an obstacle for us, where we had to think very, very differently quite quickly, because otherwise we wouldn't have been able to register the home without a registered manager. So you're right, that role is absolutely critical in the delivery of the package of support to the home. So we were fortunate to have an excellent registered manager already that we had in Powys. So we were able to kind of fill that gap quite quickly by just considering a different plan and a different way of working, which was really helpful. In terms of backup plans, that's a real challenge, particularly in a climate where residential staff and care is really problematic in terms of recruitment and retainment. So Holly obviously is going to deliver a presentation a bit later this morning, but what we are thinking about and doing is where Joe showed the leaflet drop in terms of something very specific. What we've done is do some very specific targeted approach to recruitment. And then in the sense of your retainment, we're looking at how we can develop our grow our own programme around our residential staff in particular. So you'll have heard me talk before about our grow our own social work staff. So we need to do something very similar to grow our own residential staff and then grow our own kind of succession planning in terms of our deputy registered managers and our registered managers. So this is the learning we've taken, I think, from last year, is just kind of reflecting on where those gaps are, what do we need to do differently, and how can we do that? So there's lots of thought happening around that kind of concept really of growing our own residential staff. How do we do that? We're looking at a practice framework currently that kind of matches the practice framework that we have for social workers in practice, for our residential care staff, so that we're standardising the quality of care across all of those homes, what's expected, and that will feed then into a training programme that's specific, that kind of regular supervision and appraisal, that succession planning, that development of individual staff to enable us to keep those staff in those posts once they come and work with us. In terms of the not-for-profit agenda, just to add really, Welsh Government are really keen that every local authority pushes forward for that. And one of the concepts around that is there could be residential homes that are operating in Powys in Wales currently that might either decide to move out of Wales because of that, or they might change their model. We don't quite know that in terms of the market. That's what we're anticipating. So there is an opportunity too, in terms of maybe tapping into staff where other homes are maybe moving onwards, doing something different. So it's a market that we're kind of always kind of looking at really and shaping and considering how can we do things differently.
Thank you, Sharon. I mean, I was just thinking about the leadership in the accommodation, if, for example, the registered manager wasn't there. But thank you for that, and thank you for all the extra information as well.
No problem.
Councillor Shan, are you commenting as a cabinet member? I know you're not portfolio holder for children's, but is there happy to take a comment?
More as, I suppose, my interest is a co-vice chair of the RPB, and also in terms of experience. So it's just a very brief comment on your question around, do we have confidence that step down is possible? And I would say, so I worked for 15 years as a therapeutic worker with children with highly complex needs, and it was always in the community, apart from those who did end up in secure accommodation, and they were always just in the community, and we would work with them for 2-3 hours a week, whatever it was maximum, really. Sometimes it was just an hour. And we were still able to affect change, and we were still able to help them build the capacity to live in the community in not quite so much trouble and such pressure as they had been before. So I think I have absolute faith that when you've got the safe space for them to be free from the pressures that they live with in their daily life, if they're left in the community, that step down is absolutely possible. I just wanted to interject my experience in that.
Thank you.
I think, Sharon, would the movements of these children be captured in the monthly performance reports? Because it would just be interesting for us to know, sort of in 12 months' time, is it the same children still there? What provision have they stepped down to, and any sort of data that you capture from it?
Yeah, we capture all the data on our step down processes through our Closer to Home board. So if you want us to come back maybe later in the year to talk through that maybe, and so that you can compare and contrast that over years in terms of those step downs, I'm more than happy to bring that to
Yeah, I think,
Scrutiny.
or even if it's just a a quick written update or a verbal update rather than a full presentation, that would be really interesting. Thank
Yeah,
you.
no problem.
Councillor Gareth.
Yeah, just one quick follow-up question around the age range of the children you expect to use this facility. Would I be right in saying they're going to be top end Key Stage 4, Key Stage 5, so 15, 16 plus?
Yeah, up to 18. So any child within that trajectory, but it's more likely to be children who are 14, 15 upwards, really.
Yeah, so would there be any consideration of utilising the local mainstream schools for education delivery or not?
Yeah, definitely. That would be part of looking at that sort of collaborative approach with the virtual school that we've got, and then looking at the local area in terms of what that education provision is from there. And actually, yeah, we've been doing some of that already.
Yeah, because I forgot the name of the school, no, Brohalfton, the school in Mahant, they're all Welsh medium schools in that catchment, aren't they? So any English medium would have to be, I suppose, Llanidloes, wouldn't it?
Newton, probably.
Yeah, Newtown.
Okay. Even though Llanidloes is closer.
I think Newtown's closer, but we can double check.
All right,
But
okay.
Newtown is
Perhaps
closer.
I don't know exactly where it is, so I'll shut up.
Yeah, could I just add in, could we not talk too closely about the location? And
Yeah.
we're in a public meeting. Thank you.
Sorry.
Okay, I think that's it then on the safe accommodation. Thank you for that. And then if we go back to the previous agenda item, which Charlie's going to be speaking on, which is the foster care annual feedback review. Charlie, are you okay to report back on this one?
Yes, that's fine. I've got some slides. Is it okay if I try and share my screen?
Yeah, absolutely.
Okay, bear with me.
So just as you're doing that, Charlie, we had a quick discussion in our pre-meeting about the reason why we'd asked for this was just to find out how how you use the foster carer feedback to feed it into learning within the service, and disseminating either themes or positives that could be shared, and also then whether that's been used going forward with the new plans for fostering and attracting more foster carers in the future. So, but yeah, thank you. Over to you.
Thank you. Can you see my screen okay?
We can, yeah.
Perfect. Okay, so I've just sort of summarised in the first on the first page here just some of the ways. It's not a exhaustive list, but just some of the ways in which we are able to gain feedback from our foster carers. And as you said, some of it is largely at foster panel, which is there, but also very early on in the assessment process, we are gaining feedback. So if a prospective foster carer wishes to progress with their assessment, we're getting feedback throughout that assessment as to how that experience has been, and that's really important for us in terms of how we are portrayed, really, how we are delivering our service to prospective foster carers. And then at the end of that process, they'll be presented at panel, and at foster panel generally there's questions about how the process has been, how have they found it, and that feedback is gathered and shared. At foster panel as well, we have annual reviews. So those are for foster carers that are already fostering with us, and they have their review. And again, there's quite often key themes that are shared at foster panel. And at foster panel, we are able to sort of share that quite widely, that feedback quite widely, and that's on the next slide. We deliver skills to foster training across Powys, and the trainer is regularly asking for feedback there, and feedback is gathered about how our training is delivered, and if there's anything that could be helpful. And we've been able to sort of adjust some of our training really to meet the needs of our carers following feedback. We have our locality foster carer support groups, so those are within Powys, throughout Powys, and those are direct meetings where foster carers come together and share some of their experiences and what's working well and maybe not so well at times. We have our quarterly meetings between the head of service and myself with foster carers. We have that quarterly. We had one this week, which was really positive, and we feedback information, and it's an open forum. They provide any questions that they want directly answering by myself and the head of service. We have a foster care wellbeing event that was held recently and other annual events. So we bring foster carers together with other professionals within the service, and those events have been very positively received. We've got our foster care representative on the corporate parenting group, who again feeds back. We use our direct supervision with our foster carers, so social workers are feeding back in their respective supervisions. They've all got, all of our carers have got our contact details. They've got the managers, senior managers and the head of service email, and we have an open door. So if anyone wishes to ask any questions or raise anything that they can do. We're getting our foster care feedback from the fostering network who want to take exit interviews. Again, if somebody wishes to leave for any reason, it returns to panel. Their feedback is also gathered at a panel as well. And we've got our views shared with the participation officer. So you will have met Matt Rising, who is very busy across Powys, and if anything sort of is directly raised, he comes to me generally, and we have those discussions to see if we can implement change. So that's some of the ways in which we're getting feedback currently. And this is how we're trying to use the feedback within the service. So as you're aware, we're looking at our fostering framework at the moment. A large element of the work that we've done to inform that framework has been around our foster carers. Their views largely have been centred around their training options, the support that they need to care for these children, and they wish to progress. They want to progress in different ways. They might want to be caring for specific children, specific age range, specific need, for example, and we need to support them in terms of being able to do so. So a lot of their feedback from panel, for example, has been gathered around that, and we've been able to shape our proposal really based on what they're saying to us. It helps us to develop our service delivery. So again, it's about making sure that we're providing a high quality service. We understand that our carers are dealing with really complex situations at times, and we need to be able to respond, and that is within a multi-agency arena at times, and we need it to be timely, and we need the response to be consistent. So again, if there's issues raised, we try to resolve those issues very, very quickly. And that's another issue about any issues that are raised with us. We don't we try not to let those situations continue. We try and get a quick response, and again, if there are things that are raised, we work together as a service to address that really. We listen to the carers and the ideas that they have. We listen from positive experiences and sometimes not so positive experiences. That's how we learn really, and we reflect on some of that learning together, and some of that is done within the support groups and some of that is done within one-to-one supervision. But again, if there are things that are arising and they come to my attention, then it's about sharing that information and trying to look at appropriate ways forward. We want to understand why foster carers choose to leave, and we are reacting to that as part of our ongoing retention work, and that has fed into some of our fostering framework that is being proposed at the moment. I sit on meetings with Foster Wales, and there are other national commitments that are happening at the moment in respect to fostering, and some of the themes that our foster carers are raising I feed up to Foster Wales, and it's not just around mainstream carers, it is around our connected and kinship carers as well, so that's shaping the picture sort of higher up really. We hear directly from our foster carers within internal meetings. So I've mentioned the corporate parenting groups. We've got a foster carer in that group who shares the views of a foster carer, what it's like as a lived experience of a foster carer, and how they interact with other agencies, and provides really honest feedback, which has been really positive. And then we are also using the feedback to consider the future use of our resources, to invest in areas that our carers feel passionately about. One area potentially is around our family time locations, for example. So we're working on that at the moment to make sure that that delivery is appropriate for our carers, our families, our children. And that's hopefully a summary of what I've been able to provide you. I'm sure there'll be lots of questions. I hope I've answered some of the questions, Chair. I just wanted to provide a snapshot really of what we're doing and how it's feeding through, but I'm sure there'll be questions that many may have.
Yeah, that's great. Thank you for that, Charlie. That's really helpful to see that, you know, there's other ways of getting feedback, some of which I hadn't thought about. Members, have you got any questions on the presentation? I think probably just putting your thinking caps on at the moment. Just if I can ask a couple then, please, Charlie. For the exit interviews, and you said that then you use that information to shape things going forward. Are you able to give us an example of themes over the last year or so where there's something that's arisen and then you've been able to change something that you've been able to, well, I mean, not necessarily from the exit interviews, but, you know, to try and stop people leaving, really? That's my first question. What have we done differently in the last year?
Yeah, some of the themes, I haven't added the themes because some of it would be sensitive information.
Yeah, absolutely.
Happy to bring that back to a confidential forum if you so wish. But we know that there was feedback around the changes of social workers and foster carers finding that fairly challenging at times, particularly around children's social workers. And we've done an awful lot of work within the service to create workforce stability, which I think is evidenced quite strongly in our Grow Our Own scheme at the moment, and the fact that we've got more permanent managers and the workforce definitely seems to feel a lot stronger. And I think that was a theme that was coming through, that was shared, and obviously changing the social worker is something we always try to avoid, but at that point in time it was very difficult. That feedback led to us being able to look at, you know, with CLT and other and with head of service, what we could do about that. And that seems to be the feedback in respect of those challenges doesn't seem to be coming through as often as it once was. So I think that was a theme, and we acknowledge that was a point in time, but we're further forward from that now. And Sharon and I met with the foster carers this week, and it was really fairly positive, really, around how things are going. And that wasn't, for example, raised as an issue at all, and it's not something that I'm hearing through panel at the moment either. So that's one example I can provide in terms of what it, you know, what was happening on the ground for them, and I think they've seen some real movement in that area.
What about the theme of the support they get where there's been allegations made against them? Has that ever been a theme in the last sort of few years?
So yeah, and it's something that Foster Wales, so we work within the region, and I work alongside Foster Wales as well, and that was something that the region, as a region, we'd had raised, and there's been specific training put on by Foster Wales for our foster carers around allegation and how to manage allegations, for example. So again, if I've provided the feedback from our carers, but from a regional aspect, we're getting that feedback as well. So yeah, that was something that has been raised, not just within Powys, and that training has been implemented now.
And have we upped the support on a personal level where there are allegations made?
So we have always been out. We've got the fostering network for support, and we encourage our foster carers to access that support when necessary. Our supervising social workers continue to support our carers through any allegation that's made, and there is a process that's followed. And I think that the stability within children's services and the fostering service has definitely, and with the permanent managers in place, has definitely assisted with the support our carers are getting.
Okay, great. Thank you. Councillor Gareth.
Yeah, just very quickly, Charlie, thank you for the presentation. Just following up from the point Amanda made around the exit interviews with the foster carers when they decide to leave. Do you ever follow up after, say, 12 months, 6 or 12 months, to have a further discussion with them to gain any other information, or where they would consider coming back into the fold as such?
We don't at that point, because at the point that they have chosen to leave for whatever reason, they're no longer Powys foster carers, so we don't have that ongoing established relationship. We do understand largely what's led to a carer choosing to leave, and it's for many reasons. It's there's lots of reasons that we capture. We generally have quite a good understanding through the supervision process of our foster carers as to what's coming about and why they possibly reached that decision. It's also then fed into panel. They may or may not wish to attend, but that's fed into panel. It comes to me as the agency decision maker. So then I'm collating the information all the time, and then I can feed back to the teams to ask for, if there are things that are arising, how are we going to address that? How are we going to hopefully resolve that so it doesn't happen again? But no, we don't generally recapture that information at a later date. But what I would say is that some carers choose to leave for different reasons, and they come back, and we're seeing a couple of our carers doing that at the moment. They've possibly left for personal reasons and returned. So we aren't capturing that, but the fostering network are undertaking, will undertake our exit interviews moving forward. So again, it's capturing all of that information and providing it to us.
Thank you.
Any other questions from members? Just another quick one then, Charlie, sorry. Do you get the information for those potential foster carers who start the process, or even make initial contact to inquire about the process, but then drop off part way through it before they get, up to panel? I know I've heard anecdotally over the years that people have just been overwhelmed by the amount that's involved in terms of the necessary forensic nature of the process, but also the admin side of it. Do you capture that and try and give people assurances, or try and enable them to complete all of the information in a way that suits them? Because everybody, without going into too much detail, I know how forensic it is, and it could be quite daunting for potential carers who could still be absolute assets to us as carers.
Yeah, absolutely. We have monthly meetings under the not-for-profit board meeting, really. So all of that data is provided under that meeting and under that umbrella. And it's tracking all of our inquiries. So we have got a really robust system around tracking our inquiries and the whole process moving through the system. What we are able to capture at the moment is, if somebody is showing an interest, and the reasons why they may not wish to proceed at that time. Also, if they've started an assessment, and sometimes there is a gap in their assessments from the point of which they've made their application to starting, because, as you said, it's an awful lot of information to take on in one stage. So we've got two recruitment officers that are really supporting our prospective foster carers, and at the time of which those people wish to proceed, it moves on to our mainstream care, our mainstream supervising social workers. But we do recognise it is a long process. It's an intrusive process, and we do our very best to support those people to understand that from the beginning. Sometimes we will encourage those carers to attend the Skills to Foster training first. So they've shown an interest, they'll attend the Skills to Foster. So that training offers them a broader perspective of what they're embarking on, really, to make an informed decision. So it's down to personal preference. Some carers have previously fostered elsewhere, are choosing to come to Powys, have moved into the area. They may wish to proceed very quickly, whereas others want that bit of time to really process and make that informed decision. So, and we take carers that wish, that may have very different preferences, that may just wish to do respite only initially, emergency placements or long term. So again, we're sharing all this information at the very early stages, really, so that they can see sort of what works for their family and their own life commitments, really.
And do you think there's less people dropping off partway through the process now than we've had previously, or is it difficult to know?
For those that, so when we have our initial inquiries, we do a screening. So we have those conversations and we screen, we go and do home visits. Sometimes they may have things happening at that time that just, wouldn't be conducive to fostering, and we encourage them to reapply at maybe a different stage. Sometimes, there are practical elements that may not warrant them being able to proceed. But generally the ones that we have screened and done the home visits and are positive, they are progressing further forward. So I would say that we are seeing more assessments starting and proceeding to full assessments to panel than we were previously.
Great. That's it for questions from me. Anyone got any final questions? No, thank you for that, Charlie. That's something I've wondered for ages since being on foster panel as to how you use all of the information. So no, I really appreciate you you coming with all of that. So thank you.
Yeah, thank you, Charlie.
Thank you.
Yeah, and if you're not needed for the next items, then please feel free to leave. I know you've all got busy commitments and stuff on today. So the last item on the agenda is the responding to the council's recruitment and retention challenge in social care. Do we have the officer leading on this, Kath?
Yes.
Yes, we do, Chair. It's Holly Gordon.
Oh, hi, Holly. Sorry, I couldn't see you. You've just
Holly.
Your face has just popped up on the top row. I can see. Hi, Holly. Welcome to panel.
Thank you.
We've thanks for providing the paper as well in advance, which we've all read through, and we've discussed it briefly in our pre-meeting today. So we're happy just to hand over to you, but just to let you know, we have all read the paper, so you don't need to go through it line by line in loads of detail, because we've already planned some questions for you. But perhaps it would be helpful for us if you could just explain your role in being involved in this side of things, and also just give us the key headlines from your paper.
Certainly, thank you, and good morning, everybody. So my name is Holly Gordon. I'm the Senior Manager for Safeguarding and Quality Assurance for Powys Children's Services. And within our current structure, our practice development team sits within safeguarding. So they would be responsible for ensuring we have an annual training plan for our social care staff. They are managing the Grow Our Own process, as well as elements of quality assurance that are specifically for children's services. So just in terms of the paper, I've provided an overview of our recruitment and retention activities that we undertook last year, and then started to reflect on our plans for this year. So what we started doing last year was we started coming together to meet every few months with adult services colleagues, children's services, our comms team, etc., to put our plan together in one place, really, because recruitment and retention activities are so broad and they're covered by so many different people. We wanted to kind of really have one document that pulls together the doing, if you like, what we've done, and thinking about how effective that was. And I think that was particularly helpful. For example, when we had the JICPA last October, we were able to provide that document to the inspectorates to outline our recruitment and retention activities. So you can see, first and foremost, what we started doing last year was changing the way in which we advertise and reviewing that, making sure tasks and roles were very clear, updating and modernising our approach to advertising, as well as using the new corporate branding available to us. So we also held some social work recruitment events, which we hadn't held for a couple of years over that lockdown period, although we did hold a virtual recruitment event during that time. So we held 4 physical events, either just within Powys boundaries or just outside. And those were strategically considered in terms of the position and the location. I think there was some successes, but it was limited. So, for example, for 2 of the venues, we didn't actually have anyone attend, but for 2, we did have some people come and join us. And it's such a challenging area, but I really want staff to, you know, continue to feel motivated. And I think that there are things which perhaps you aren't able to measure when you're running a visual campaign and you're engaging with social media, etc. And that's, you know, just ensuring our name is out there, that social workers are aware of our service and our current positioning as well, in terms of service delivery. So one of the things that supports us in preparing for our recruitment campaigns is a staff recruitment and retention survey. So last year we undertook this and we had 91 responses from Children's Services. We have just finished the survey for this year, and we are currently analysing the results for that. But last year's what we asked staff was, you know, why do they stay? Because I think traditionally workforce development might intervene at the point where a staff member is leaving to ask them why they're leaving, but we really want to understand why our staff stay and what they feel are the benefits of working for Powys, so we can highlight that into our recruitment campaigns. So you have some of the key headlines from the survey, which is very helpful in us understanding our staff satisfaction levels. In terms of this year, we're going to learn from our activities last year, and we're going to be delivering 2 physical social work recruitment events within Powys. We also have wider national events which we attend. We run stalls, and also our practice development manager delivers a seminar around practice in Wales. That obviously allows us to highlight Powys as well. In terms of the information on our employment in terms of starters and leaver rates, you can see over the last 12 months a change, and that change has been fairly consistent in that we're now starting to recruit more people than leavers, which is really positive. And of course, this is having an impact on our agency social work rates within Children's Services. So you can also see the table there, a gradual reduction is happening, and we're projecting that reduction will continue based on the Grow Our Own outcomes. So I've explained the Grow Our Own project in some detail. I hope that's clear. I've highlighted the current numbers and previous numbers for our Year 1 degree, which in and of itself can be a standalone qualification. And then we move on to our degree. So that's covering Year 2 and Year 3 of the social work degree, which is a competitive process. And you can see from 2020, we have gone into scale up, and we're now offering 12 degree places per year. And for Children's Services, we've supplemented this with an opportunity for staff to apply for a master's course. That master's is fully funded and staff are paid at grade 7. So we've had 2 staff who have successfully completed their social work qualification, and we've got a further 2 students who have just started in 2023. There is some consideration of whether we should continue this in the future. What we are hoping for is that the Open University will commence their Masters in Social Work, and that would be a more financially viable route for us to follow. And what we have seen over the last few years is that many people coming through the social work degree course have already got other degrees. So the Masters may well encourage more people who have already done that work to move on to a higher qualification. So I've outlined our practice learning opportunities. So that's our social work student placements. So we're really pleased about the increase in that. So you can see in 2021, we had 15 students across children's and adults. And this year we have a total of 30 students currently with us, 25 of which are from our own staff cohort and 5 are from outside universities. And just to really stress what a challenging task that is, and how much support we have from all areas of social services. And I've also put some additional information around our practice educator role as well, and every student social worker must be allocated a practice educator. I've also put some of the projections. I've caveated it because it's quite challenging to predict the breakdown division between adults and children's services, as well as predicting which service area people will go into upon completing their qualification. But so far the projections have been correct, and this year we are expecting 8 newly qualified social workers to come out of this programme for children's and 5 to come out for adult services. So in terms of staff retention and wellbeing initiatives, I think this is an area that's developing in a really innovative and exciting way. And we're really pleased that it's been recognised on a local, regional and national level. So we've had some interesting developments. We've had a staff wellbeing day. We've also implemented decompression sessions specifically for our newly qualified staff to support them with the demands of coming into practice. And we also have debriefs available for staff when they've been exposed to traumatic or distressing material or events. And then lastly, just to say on that point, we've also now commenced our SWORTS rounds, which is a method of social workers sharing case details in a reflective space and others learning from that process. So the first one occurred about 2 weeks ago, and we had 60 staff who were in attendance, and those are now planned in for the rest of the year to occur every 2 months. Then also, just to add, this work has also been recognised by Social Care Wales, our workforce regulator, in terms of us being finalists for this work, for the Social Work Accolades Awards. There's also an update on the Health and Care Academy, which was provided to me by Julia Toy. So that outlines the work that they're undertaking with the Academy Careers Education Enterprise Scheme and how many young people they've reached with that programme. And then lastly, there's also some information on our childcare workforce relating to the Flying Start expansion and the apprenticeship scheme. So yes, I think that's probably summarises the paper. Thank you.
Thanks, Holly. I know we've got a few questions, but I just thought I'd ask Councillor Shan as portfolio holder or Sharon as head of adults whether they wanted to add anything into what you've said.
Thank you, Councillor Amanda. No, I don't have anything to add. Thank you, Holly, for the report. It's comprehensive, and for the progress that you're making.
Thank you.
And Sharon?
Nothing from me, Councillor Amanda. Thank you, and apologies for joining late.
Don't worry, we've been on children, so you're not late from our side of things at all. Okay, so generally we thought the obviously the data is really positive and things seem to be moving in the right direction, and I think we've just got a few questions on some of the background to things. Councillors on the committee, who wants to kick us off with some of the questions that we discussed in our pre-meeting? Just to put you on the spots. I know Gareth, Liz, Carol, you had a couple. Who wants to go first?
I will, Chair.
Okay, go for it, Gareth.
Yeah. Thank you for the presentation, Ollie, and thank you for the paper. I've got a couple of questions. In the survey that undertaken last year, you said that 91 staff from Children's Services responded. What's the total number? 91 of how many? But I'm a bit of a numbers geek, I'm afraid. I just wonder what percentage response you had, and whether you had, was that survey also open to agency staff?
Yes, it was. We opened it up to all staff in children's services. I'm not sure if Sharon has the total number in her head. Sorry, it's not in my head.
Okay.
In mine, it's about a third, Councillor Gareth, that responded.
So it's about a third. Okay, right. So that's not a bad response rate then.
Yes, it is better than the one we've had this year. So I think this year we've had just below 80 respond. We are mindful of survey response fatigue. So I think we were quite happy with the response rate for that.
Yeah. And I am, as I said, I'm finance number orientated. Can I just ask a couple of other questions? And this is one most likely for Sharon, and I don't expect to have the answer today, but perhaps you could actually do some work and send it to, or Jackie may have to do the work. Could you let us have some information on the difference between the cost of a permanent member staff and an agency member staff, just so we can get our head around that, and so we can just evaluate that process. And then linked to that, which of the teams have the majority of agency staff? Councillor Liz and myself did a layman meeting, attended a layman meeting with a team earlier in the week, and 50% of that team was agency staff. And it's quite interesting. They responded to a lot of the questions themselves. But so that's just from me for now.
Yeah, just to follow up on that last question by Gareth, I think we're interested to see whether agency workers are more focused in certain departments, and if you look at it on that sort of localized level, when you're working at about how to, retain or encourage some of those agency staff to come over to us.
Yeah, so I can answer some of those questions. So in terms of the costs, I haven't got the specific costs in front of me right now, but I can certainly get to you. But roughly, a permanent member of staff versus an agency member of staff is double. The agency is double, really, the salary of a permanent member of staff and more. But I can get you the specifics on that. So we do a cost benefit analysis on the daily rates, the monthly rates, and the yearly rates for all our agency staff. So I can easily kind of forward you that data. In terms of teams, in terms of agency staff, and thank you for visiting and doing your layman visits. I'm really grateful and appreciative of you doing that piece of the work, because I think that's really important in terms of scrutinizing what we're actually doing and what we bring to you and present to you, that you then have the opportunity to go back into the service to actually test that out and see that for yourself. So really thank you for all of you that have taken part in those layman visits so far. That we absolutely know where our agency staff are. So we've got 21 agency staff currently. We know exactly who they are, which teams they're in, and actually what the requirements of that. So I know the team that you visited. So I know that that's a difficult team to recruit to because of the experience and knowledge that's required for that team. And we also know that we have one other team, what actually is largely supported by agency staff, which we are looking at how we can maybe target those teams in a different way through a different kind of recruitment lens, but also with our Grow Our Own programme and our hopefully our 8 cohort coming into the service this year. It is also about managing that safely. So we know that some of those teams that are the difficult to recruit to are the teams we need the most experience in terms of the workforce in. So it's a navigation of kind of supporting newly qualifieds to kind of come into some of those teams where their situations are much more complex, how we support them to grow, learn, develop, to then retain them in those teams. But it is like a scales. Sometimes it tips one way and the other, and you've just got to navigate that. But in terms of the assurance for yourselves, we absolutely know all our agency workers, which teams they're in, which are those teams where there's the greatest need and demand. What is that about? What can we do differently? Can we think about different ways of recruitment, etc.? And we have taken some risks with having more newly qualified workers in certain teams. So it is a constant learning and evaluation of that process too. I actually met with one of the teams last week where we did take on 3 newly qualifieds in one team, which was which was a risk because we knew about the lack of experience they would have coming in, not the motivation, not their kind of desire to be social workers, but just that experience of working with really complex situations. And what they were saying to me was they felt that the benefits of having a small group, almost like their own peer group in the team, was invaluable in terms of them learning together as they kind of progressed. So while us as Holly and senior managers, we manage the risk when we have those particular challenges in a team, actually the benefits for them as individuals was actually they felt that they got a lot more out of that by working together in a little peer group within a team. So yeah, it's something that we're constantly looking at, reviewing, evaluating, but we've got all of that information that we're able to analyze.
Great, thank you.
Thank you.
Gareth, have you got any follow-up on that?
No, that's fine. I think Sharon's response was what I was expected around the particular team we visited on Monday, Tuesday.
Councillor Liz, did you have a couple of questions?
I did. One's on the back of the agency workers, Sharon, just a very quick one. I can see the correlation between Grow Your Own and the reduction in the agency, and I think that's really, really good. You know, over the last few years, I've seen that definitely an improvement coming. But what percentage is the 21 of the total social worker, qualified social worker workforce? How many social workers have you got?
Right, I haven't got that figure to date in
It's all
terms
right,
of
you can
exactly
give us
how
it.
Holly might know it, but I know that we've got 19 vacant social work positions at the minute. And because our workforce is comprising of all sorts of different practitioners, I don't have the total number of social workers before me, but I can get that to you.
Yeah.
In terms of our 21 agency workers, I'm going to kind of say it's it would be less than 20%, I would think, just thinking numbers off the top of my head, but I can get that figure to you. So you will remember that at one point we had 57 agency social workers. So the trajectory is coming down all of the time. And then this year with our cohort of 8, and when we're looking at our agency workers of 21, that number's going to come much lower than that, hopefully, if all goes to plan. I think with children's services, we always have to think that there'll always be a need potentially for agency workers. We're never going to have a full workforce of qualified social workers at any one given time, because people will move posts, they will want to progress, they might leave the authority for all sorts of reasons. And it's just about us managing the number as low as we possibly can within managing the service as safely as we can. But I can certainly get the number of exactly how many qualified social worker posts there are to you, Councillor Liz, and happily will forward that on to you.
Yeah, thank you. And then the same question, Holly, it was around the 9 apprentices that are working with the younger children. I just wondered, could you tell us a bit more about how they were recruited, where they came from, and what kind of level they're working at in the organisation?
Is that the Flying Start
it was
ones?
very positive.
Is that the Flying Start ones, Liz?
Yeah.
Yeah.
That is an area that Joe Harris has led on, and Joe contributed to that paragraph of the report. So I don't have any more information in terms of how those people were recruited, whether it was via the corporate programme or another means.
Okay, well, we want it for information. Well, I wanted it for information, so it's okay for it to be sent on. Thank you.
I think also, Holly and Sharon, we're interested in whether or not how they're recruited, and that idea is being looked at as to whether it could be used for any other apprenticeship schemes elsewhere in the service. Is that model really unique to being able to work to Flying Start expansion, or is that something else we could look to do elsewhere?
No, really good question, and thank you for that. I don't know the answer how Joe has kind of been instrumental in enabling that to happen for Flying Start in terms of the specific details, but happily we'll look at that. And we've got a variety of apprentices across children's services currently outside of the Flying Start programme, which actually they've been invaluable really in terms of offering them experiences, being able to grow them and nurture them, improving their skills. and they've been actually instrumental in some of the work around contributing to our training brochure for this next year, and actually the way in which they've worked and the support they've had through Holly's service area has been invaluable for their learning process too, and that's recently come forward to me as a compliment in terms of the work that they've undertaken. So yeah, absolutely, we'll find that out from Jo and feed that information to you.
Yeah, I'm kind of interested as to whether or not all this full feeds through the Health and Social Care Academy. I know that that is referred to in the report, and one thing I would like to put on our work programme, if this could be noted, please, Kath, is I really would like an update at some point this year on the Health and Social Care Academy, and how it fits into all of this in terms of sowing the seed for recruitment, which I know it does because it's got good relationships with most of the schools, but I kind of don't know where it fits in the jigsaw puzzle of all of this. And also I'm quite just wanting to pick up on some of the feedback from Llais from last year in the summer. There was comments in that feedback that they didn't know what the Health and Social Care Academy was, or that it even existed. So I think that's a piece of the puzzle I think that we'd like a bit more information on, and also then on how where you've got a new initiative that sounds really great, how is that then looked at as being applied elsewhere? So that's one of my questions. Liz, was those all your questions answered?
They are, yes, thank you.
Councillor Carroll, did you have any questions that needed to be addressed?
No, all my questions have been answered, thank you.
Okay, I've got a couple more, sorry, you'll get used to me. A couple more questions. In the report where it talks about the wellbeing initiatives, Councillor Gareth and I went to the National Safeguarding Conference, which I can't even remember when that was now, but I think it was at the end of last year. Last November, and it was really, it was really informative. And one of the workshops we went to was with the in-house psychologist, and we heard about the wellbeing initiatives. But I just wondered, obviously this is a new thing that we've done, and I think it is a really positive thing and very vital, especially in children's services. But it obviously comes at a cost of recruiting additional posts. So I wondered, are the people in those roles, are they at capacity? Because it's obviously just applies to one service, and is there, if not, or is there any room for them applying some of those wellbeing initiatives? And perhaps this is a question for you, Nina, as director, elsewhere outside of children's, because there's traumatic and difficult work that's done in adults and in education, and I'm sure elsewhere across the council. And if that's having a really positive impact, is there a way we can make sure that it's really, really efficient, given it will have a cost?
I mean, I can start that question if Nina wants to come in after. So it's really important to me. The whole well-being of the workforce is part of our integrated business plan in terms of building a resilient and supportive workforce. So for us in children's services, the trauma and the impact of the work that social workers do can never be underestimated in terms of secondary trauma, in terms of what they're doing and how they're doing it, what they're reading, what they're seeing, what they're doing. So it is different, in my view, to other parts of the service, but that's not to say that trauma shouldn't be recognised and understood. And if Councillor Shan was speaking, she would very much want us to be a trauma-informed organisation, as we all would in terms of that. And that's definitely part of the route that we want to take and where we want to go to. In terms of the capacity of the individuals that are working within this concept right now, they're not at full capacity. That's built into their work programme of what they're delivering. But having said that, as we're growing what we're trying to do, there is a potential then that we're going to need to think about maybe some different positions in different ways to further strengthen and support what we're trying to evoke. So it's definitely a reflection, a learning opportunity while we're growing and developing, and then looking what we can do differently. And I guess that then leads on to Nina in terms of thinking about that wider concept into adult services and well-being as the whole directive.
Thank you very much, Chair. Thank you, Sharon, as well. I think it's a really good point, Chair, and a good question. And for me, it's really important that, you know, the good work that's done in any services, and, you know, that's shared across not just directorates, but the wider corporate body as well. So the way that we do that sharing and learn is through our senior leadership team, whereby heads of service can come along and do a presentation on a project or program, for example, how it's gone. And equally, it's important to share kind of learning where things go well and where things don't go so well as well. So that learning, but senior leadership team is that space where we do that. And I think it's a really good point, and I'll have taken an action down to note that we make sure we share, you know, the wellbeing support that we're doing in social services wider across, because of course it's a corporate priority. It's just not a social services and wellbeing priority. You know, supporting our wellbeing and our staff is really important across all of our services. So I will absolutely take that away, and thank you very much for the question.
And, you know, I guess it's seen as an investment to save, isn't it? Because if you don't make sure that these social workers are supported, then potentially you could see them going off on sick leave. So have you been able to gauge whether or not it's made an impact in terms of reduced sick leave, or I guess
definitely.
even reduced emotional burnout as well?
I think so, Chair, because if you look at our numbers of leavers and starters, and then our correlation of sickness, the sickness levels in children's services are really low in comparison to where they were many years ago. So that indicates that wellbeing is absolutely at the heart of the service delivery model. And absolutely the things that we're doing and testing out and trying to do differently are having an impact on that individual person's well-being, but also that team's well-being, and then the service well-being. So it all links and interconnects in my view.
And you've said exactly, you know, the reason why we're sort of asking this question is because we know that sickness is so much improved in children's, but there are issues elsewhere in the council. So is this something that is working well? I do agree with you that the level of you know, secondary trauma is heightened in children's, but there is an impact in education and in adults and possibly elsewhere, which is why, you know, I just want to make sure that this could be looked at for efficiency elsewhere. But I'll leave that one there. Another question I had is, Holly, you talked about you're going out to advertise more recruitment events, and I just wondered if you could just give us a quick overview on where they are all advertised, if you have that information. I know that they're advertised online because I've seen them, but I just get a sense that I think less and less people are starting to use social media as of adult age. I think there's a lot of sort of people are just a bit exhausted with everything they see online. So I'm interested to hear how you advertise not online.
Thank you. We do, with our corporate comms, evaluate the kind of through fall clicks, etc. So we do, we obtain that information, which helps us kind of understand the level of interest. And for last year's campaign, we did have a lot of people coming through via the social media advertisements for the work, for the actual physical job fair events. I know our corporate comms are currently liaising with local press as well, so they are going to prepare like a press release to promote, but obviously that would be then up to the individual newspapers to whether they wanted to promote that. And then there's also been discussion for this year of potentially something on the radio, but some of the perhaps more standard social work areas to advertise are increasingly incredibly expensive. So we have resorted to more reliance on social media. Yeah, it's a tricky one in terms of balancing cost and what we may get from that.
Something I've suggested previously for other things, which I think is really, really cheap, is using councillors and their intel for their local area, because lots of wards have local leaflets, newsletters that go out every month or every other month. And they don't have them everywhere, but for things like this, they often either charge very little or not at all. And if I get sent a PDF, or if you have a list of the editors and you send them PDFs, they will just put them in there, and then that goes. In my ward, that newsletter goes to every single household, and it is read particularly by more people over a certain age, but then who talk and share that information on. So I would suggest that as something physical. And also with schools, I know that schools are sharing more and more information, and it's a balance, isn't it, of not asking schools to share too much to parents. But we get all kinds of information on family type events in the area, and recruitment fairs. We've had information on those previously for where they've been at the high school. So it might be worth looking as to whether or not schools would send those informations out. They use systems such as Scoop, which is an app, rather than it going out over social media. So that's just a suggestion from me.
Thank you.
And then my final question is just, obviously, at the end of the report, we just had a comment in our pre-meeting about how it would be helpful to sort of next time this comes to us, and we would like to come, this kind of thing to come to us again in the future, is sort of to have a little summary on what next. Where do you go next? Is there anything planned on the agenda that's not been covered in here? Because I know you have stuff in here that's going forward, but a little bit of a conclusion really as to what now.
Thank you. Yes, I'll certainly take that on board. And I think, I guess from my perspective, I think we need to keep going with what we're doing, and ensure staff don't feel disheartened that this is such a challenging area. I think it's about being very stable, very calm, and building. And like the discussion we were having earlier about the challenge of, yes, it's great to see our agency numbers down, but actually that then presents us with a different challenge, ensuring that newly qualified social workers are supported. So I think for me, it's about slowly, steady reduction of numbers, whilst at the same time building the confidence and supporting the well-being of the new staff. And we've certainly took that into consideration when we're planning our grow own figures, because we understand the challenges of flooding the service area with too many newly qualified staff. So yes, I think we definitely need to keep doing what we're doing, keep building on that. If we come across further innovative ideas, we could obviously consider that and take that forward. I feel that we're probably doing everything that other areas are doing. We're certainly not doing anything less. And I think for myself, when I think about certainly the grow own, I do see the recruitment challenges for the council, or the solutions to be within our own communities, and working together to I guess promote the opportunities.
Yes, so I think our next steps, Chair, really are about, as Collie's saying, consolidation of what we know works well, and then looking at the cohort of our grower own, because as they grow, they get year-on-year experience. So what we don't want to be then in as a position, in as a trajectory in maybe 2 or 3 years' time, when they've gained their experience, that they then want to move on to somewhere else. I mean, hopefully they'll move on within the council, so that would be great. And recently we've had some of our workers move on to adult services, which is a real bonus for Sharon Fruin. And whilst that's a loss for children's services, actually another area has gained that, which is absolutely great. And that's what we want. We want people to be able to move around the council and apply for different positions. But what we don't want to be in a position of is 2 or 3 years' time, when this cohort have grown in experience, that we then lose them. So we're looking at a practice framework that we can potentially match with experience experience, skills, knowledge to enable us to keep those staff, but progress in maybe different ways, but remain within children's services. So it's always kind of looking ahead, but taking stock of where we're at now. In terms of development opportunities, I think you raise a really good question about what are the next steps, and it's about, I guess, marketing ourselves and selling our good news stories, and actually spreading that wider, because there is a national shortage of social workers. But what we're hearing is that we've had agency workers that have converted to permanent staff here. We've had agency workers that have been here quite a while and are thinking, actually, those positions are getting less and less and less. Is now the time to apply? And there's been a lot of national work around that in terms of movement of agency workers across different local authorities to get better rates of pay. So over the last 12 months, we've seen much more stability around that in terms of movement of agency workers. But also we recognise that actually some of our agency workers are saying, we really like it here, we want to stay here, and they're starting to think, shall we now move before those positions get less and less and less and less, and there won't be positions. So yeah, it's always a fluid area, but we can definitely do more, and I absolutely take on board about what is the next step. And there's definitely something around just selling the story and communicating that narrative wider. Both, I think your points around using what we've already got in Powys are really good things. We should take that forward, and also I think how we kind of portray that nationally, etc. And with our bordering authorities, some of those are having real challenges right now, and it's not about us poaching staff. That's not what I kind of want necessarily, but there is an opportunity in that as well, in terms of just saying what we've succeeded on, what we can offer here. So I think we'll see that kind of grow, but really welcome your comments, because I think they're really important for us to kind of reflect on.
That's great. Thanks, Sharon. And Nina and Sharon Fruin, anything else to add before we wrap up?
Yeah, could I just add, Chair, and kind of follows on nicely actually to something Sharon just touched on. You know, obviously this morning, Holly and Sharon have talked about what we're doing within our social services here within Powys, and we've touched a bit on corporate. But I thought it might be useful for you as a committee just to be aware that there's a lot happening at a national level as well. And as part of the Directors of Social Services across Wales, you know, we've got a national workforce programme as well. And one of the things Sharon just touched on was one piece of work under that programme that's now 12 months into kind of operation is a memorandum of cooperation in terms of children's social workers. So that's children's services leaders across Wales working together to kind of tackle the issues with agency churn, as Sharon said, and pay, and people moving around, just jumping to higher pay, etc., reducing the numbers of social workers moving from permanent to agency staff. So we've got this memorandum of cooperation. We're 12 months into it. It's been really successful, and we're just, I think the annual report is being pulled together at the moment, but it's looking like it's saved millions of pounds across Wales in 12 months. And within the next 12 months, we'll be looking to extend that to adult services as well. Within that national programme as well, we're starting a piece of work looking at national terms and conditions for social workers. We're looking at a national workforce strategy. So I just wanted to raise it that as well of all the work we're doing locally, I just wanted to kind of highlight to you as a committee that, you know, Sharon and I as leaders as well are also working nationally as well with partners, with other local authorities across Wales, because workforce is absolutely key. It's the most important thing. We need to nurture, support, encourage, you know, retain. So I just wanted to give you just a very brief touch on the national kind of work that we're doing as well. Thank you, Chair.
That's very helpful, Nina. Thank you.
Thank you. And Sharon Fruin, did you want to add anything?
There was a couple of things, and I'll be brief. I was just thinking about what Sharon was saying around the agency staff, and just wanted to reiterate it's very similar in adult social care that actually the densest population of agency staff are in those really difficult and complex areas of work, and recognising the support that the staff need in those areas. And we do have dedicated forums in those spheres of operation to support staff in that. We have also seen a number of agency staff seeking out permanent employment with us. They're telling us that actually they want to work for Powys, and they've recognised that they've seen the vacancy levels drop in as well. And that I'm currently doing a piece of work with colleagues in HR and workforce development to try and, well, not try, but to create a wellbeing event as children's services have done previously. So learning from that approach for adult services later in the year.
Great. Well, one very random question for me, sorry, that just springs to mind is, do you, both in adults and children's, or, you know, the managers below you, do a review to make sure that everyone's using their holiday entitlement and that they're able to, in terms of the having appropriate cover when people are off?
It would be a standard agenda item at supervision, and the areas of concerns would be picked up, and absolutely we do encourage people to use their leave, even though they can carry over a small amount of leave. We'd encourage them to be taking it at regular intervals throughout the year to avoid burnout.
Yeah, we do the same, Chair.
Thank you. Well, that's it for me, unless any councillors have got anything they want to raise.
Yeah, can I just add one thing from the meeting that Liz and I went to, the layman meeting we went to this week? We asked them what could be done to actually improve efficiencies around that process and whatnot. And they picked the system up, the Wix system up, but they also identified perhaps some improved back office support to actually do some of the improved admin tasks. And and it'd be interesting what level of, whether you do any work around that, looking at those improved efficiencies that could be achieved in either children or adults.
Thank you, Councillor Gareth. I would imagine that the system would have come up as one of those answers. But yeah, no, thank you for sharing that. That's really important, because I can take that away and kind of reflect on that and have further discussions with the team about what that could look like, etc. So yeah, thank you for that.
Great, thank you all.
Councillor Liz has got her hand up.
Oh, sorry, why can't I see that?
Yeah, I don't think you've seen me before for some reason, Amanda.
I think it's because I can't see everybody across the top. No, across the top. And it doesn't jump back to who's got their hands up. So sorry, Liz, go for it.
It's a real quick one. In terms of what Gareth was saying about the layman visit, and we have drafted an email that we'll send, to the key people, so you can see, make sure everybody's got that. And it was very, there are lots of positives. But one of the positives was that, and it relates to the previous question, was that staff said that they always felt that they could get hold of a manager, even if, the manager was not in the office for their particular team. They'd given examples of how they'd gone elsewhere and been able to get support to either, finish a piece of work or make a decision that they were not sure about. So, but yeah, we'll drop the email to you. We've already drafted it, haven't we, Gareth? So,
well, you have.
That's great.
Thank you, Councillor Liz. That's really helpful.
That's great. Well, thank you, everybody. I think just if the committee could just stay on just for a couple of minutes, just to make sure that we've got the recommendations noted down, and a couple of things we want on our work programme, that would be great. But otherwise, officers, thank you ever so much for coming today. Really appreciate your time as always, and look forward to seeing you again in the future, which I think is, I'm not sure when our next meeting is. Do we have the date, Kath?
We do. I'm just madly going through my calendar because I was on a different page.
23rd of May, I think.
I think it was end of May, yes.
Okay,
yeah.
So we'll have a look to what's on the agenda for that, and we will be in touch, I'm sure. So thanks ever so much, and have a good rest of the day, everybody. And committee, if you could just stay on, and Kath, if you're able to take us off there, that would be great.